Can you confirm perimenopause by blood work? Unfortunately, you cannot. So often what happens is women, especially women in your age range who are in their later 30s, early 40s, start experiencing a lot of symptoms in perimenopause. And so they go to their doctor and they ask for blood work, and an uninformed doctor who has not been trained in menopause may test your hormones and then tell you that your hormones are normal and that you're not in perimenopause. But perimenopause is actually a diagnosis that is made clinically just based on your symptoms. So our blood work is not necessarily valuable because our hormones are fluctuating so wildly in the perimenopause transition, and your blood work is only giving you a snapshot of what your hormones were doing at that particular moment that your blood was drawn. In perimenopause, our hormones are fluctuating like crazy, and it's not necessarily the blood serum level of our hormones that's causing the symptoms. It's the fact that 1 minute your estrogen is all the way up here, and then the next it's down here. And that variability is what's driving all of the symptoms. So if you are experiencing symptoms like mood changes, anxiety, low mood, sleep issues, if you are starting to have really dry skin, dry hair, dry vagina, dry eyes, if you're experiencing musculoskeletal pain, if you have frozen shoulder, plantar fasciitis, or just body aches in general, if you're having trouble sleeping, if you're having hot flashes, there's so many symptoms of the menopause transition. If you're having symptoms, you're in perimenopause. You don't need blood work to confirm that, and you absolutely can start treating it. You do not need to wait until you are postmenopausal to start replacing your hormones. Also, lifestyle strategies are so important at this stage of life. So really regulating your nervous system, prioritizing your sleep, weight training and working on movement. All of that is really important. That's what I help women with as a menopause coach. I'm Julie. I'm an occupational therapist. I'm certified in women's health and in menopause coaching. So please don't suffer through perimenopause and menopause. It is a very long stage of life, but there are absolutely things you can do to feel better. If you go to the link in my bio, I have an audio series. It's called Menopause Doesn't Have to Suck. It goes through the stages of menopause, the symptoms, why we have so many symptoms, and the treatment options, both hormonal and non-hormonal, and also the lifestyle changes that can help you feel better. So check out that audio series.